Hello, my name is Cindy Abear and I will be performing an assessment on you today. I'm a DNP student with Jacksonville State University. Can you tell me your name?
It's Ashley Aber.
Okay, and what brings you into the office today?
I'm new to the town and I just need to establish care with a primary doctor. But I've also had some pain that just comes and goes in my stomach and then left wrist pain
Okay.
when I feel like when I overexert it.
Okay. We can examine those things today. I performed my hand washing technique. So to examine your abdomen, I'm going to have you lie supine with your head on a pillow and your arms at your side. Here we go. Okay, so I am going to lift up your shirt if that's okay with you, if you're comfortable with that.
Okay.
So abdomen is symmetric, the skin is intact, abdomen is rounded, there's no visible abnormalities seen. The venous pulsations are normal, no abnormalities visibly seen on the abdomen. So next I'm going to auscultate your abdomen, and that's just listening for bowel sounds. I may have to listen longer in one quadrant, so just be mindful of that. Okay, your bowel sounds are present and active in all four quadrants. Next, I will listen with the bell of my stethoscope to listen for any breweries in your arteries. Okay, so there were no abnormal breweries heard on auscultation. So next I will proceed to palpate your abdomen or percuss your abdomen, and that's just light tapping. So over your stomach, we should hear a gastric bubble. Over your spleen, we will hear dullness. That's just because there's a lot of, that's a blood-filled organ. And then just over your stomach in general, we'll just hear tympany. We'll percuss all four quadrants, and over the liver, we will also hear dullness because that's a large fluid-filled organ as well. So next, I will proceed with light palpation of your abdomen. So that's just going to check for any tenderness. So just let me know if any area is specifically tender. So no tenderness noted. So next I will proceed with deep palpation. This you may have some tenderness, but we will be checking to see if we can feel your spleen and checking your liver border. Spleen is non-palpable, which is normal. No masses noted. The umbilicus is normal and the umbilical ring. Next we will palpate for the liver border, which is normal, not abnormally large. So all areas of the abdomen have been palpated, so we can proceed with further testing to figure out what's causing your abdominal pain. And we can get a record of your diet as well to see if it may be causing, foods may be causing your pain. So next, I will have you sit up, and we will begin your musculoskeletal exam. So if you'll have front facing the camera for me. First, we'll inspect your hands and wrists. So inspecting, there's no visible abnormalities. The hands and wrists are symmetric. Contour is normal. The palm contour is normal. And if I inspect one side, I will also do it to the other or verbalize that I'm doing it. So I'm going to palpate all the joints of your fingers and your hands. All 10 digits are noted. All the joints in the hand and wrist are without any swelling or tenderness, and there is no redness noted as well. And I'll also perform this on the right hand. So the hands are normal. We'll do with range of motion. So you can flex your hands up and then extend down. Good. That's normal flexion and extension of the wrist. And you can spread your fingers for me. Now we'll test your strength. If you'll grab my hands for me. Good. Strength is equal bilaterally. Next, we will move on to your elbow. So I'll palpate and inspect the elbow. There's no redness or masses noted. I'll palpate the joints in the elbow. No tenderness noted. Okay, next we can do flexion and extension of the elbow. No pain, no popping, no abnormalities with that. And we'll perform on both sides. We will palpate the ulna, the omnicron process, and the joints in the elbow. No abnormalities. Next, we'll move on to your shoulders. Shoulders are equal bilaterally. There are no visible abnormalities with the shoulders. We're going to inspect, lightly palpate her shoulder joints. No abnormalities. I'll have you shrug your shoulders for me. Good. And now I will test the strength. Strength is equal bilaterally. Now we'll check the range of motion in your shoulders. I'll have you lift your shoulder up and then all the way back. Good. And then next we'll have you scratch the back of your neck. Good. And then also turn around, grab your hand around and grab your scapula on the opposite side. Good. So normal range of motion of the shoulder. I can also have you abduct and adduct. Okay, so the shoulders are normal. Next, we'll move on to the cervical spine. So I'll have you turn so the cameras can see your spine. Yes. Okay. So cervical spine is normal alignment. There's no visible abnormalities seen. On the spine, I'll have you touch your chin to your chest and then look up. And then with each, try to touch each ear to your shoulder. Normal range of motion of the shoulders. I'm going to have you turn back around. We will also check the temporomandible joint. Yes. Okay. So I'm going to have you open and close your jaw, and I'm feeling for any tenderness, popping, or clicking. And then move your jaw side to side. Do you have any pain? Okay, good. Okay, turn back around, and then we'll look at her lumbar and thoracic spine. I will percuss for any spinal tenderness. The spine is aligned, no abnormality is seen. So next we're going to check range of motion of your spine. I'll have you stand up. Okay, so with range of motion of your spine, I'll have you turn side to side. Good, no abnormalities. And then try to touch going down on each side. Okay, normal range of motion of the spine. I'll have you sit again, and we'll examine your hips. Okay. So I'm going to inspect. The hips are equal bilaterally. I will palpate for any crepitus or abnormalities. And I'll perform on both sides. No abnormalities of the hips. I'll have you lie on your back. And we'll check range of motion of the hip. If you could lift this leg up. Good. And then I'll have you lie on your stomach. And then if you'll also lift that same leg up to the ceiling again. Good. Okay. And then you can return to a seated position. Okay. With the hips, we could also do external and internal rotation. I'll have you lie and do that as well. Sorry. If you'll lie back on your back. Okay. And you'll bend your knees slightly. Okay. And we're just going to abduct and adduct the hip. And no abnormalities. And we would do this with both extremities. Okay. You can turn your face. Next, we will inspect the knees. So no visible abnormalities with the knees, no swelling or redness noted. We will inspect for any tenderness and feeling all the joints in the knees. Do this bilaterally. Okay, next we'll have you flex and extend your knee forward and back. Good, and you can do this one as well. Good. And then we will move on to the feet and ankles of the exam. And visibly, there's no abnormalities. The feet appear symmetric. She has all 10 of her digits. I will palpate all of her joints. All the joints in the metatarsals. No abnormalities. So we'll check range of motion of the feet. So you can point downward. And then push toward me and then pull back toward you. Good. So normal flexion and extension of the feet. You can roll your ankles. Range of motion is intact with the feet and ankles. So that we can do further tests on your wrist, like an x-ray, to determine what is causing your pain. And are you right or left-handed?
Right-handed.
Okay, so we can figure out what's going on with the wrist to determine your pain and see what we can do as far as a treatment plan.
Okay.
Alrighty, but your exam was normal. There was no abnormalities seen.
Good.
Thank you.
Thank you.